Coming to the palate, it intervenes between the roof of the mouth and the floor of the nasal cavity, and it lies within the alveolar arches. So, okay, if you can see the palate like this, it is formed by the palatine process of the maxilla and the horizontal plate of the palatine bone. Okay, it lies within the alveolar arches. Okay, the palate consists of two parts: the hard palate in the anterior 2/3 and the soft palate in the posterior 1/3. Okay, so coming to the hard palate, it forms a bony framework formed by the palatine processes of the maxillae in front and the horizontal parts of the palatine bone behind. The upper surface of the bony palate is covered by ciliated columnar epithelium of the nasal cavity. The lower surface is lined by keratinized stratified squamous epithelium, and it is provided by mucus secreting palatine glands. Okay, the mucoperiosteum, it presents a median raphe which ends in front in a small papilla which overlines the incisive fossa. The several transverse folds they extend bilaterally from the anterior part of the raphe and make the lower surface corrugated. The hard palate lies at the level of the axis vertebrae in adult. Okay, it descends in adult. At the infant, it lies at a higher level between the skull and the atlas vertebra. So in the adult, it lies at the level of axis vertebrae. It descends. Okay, with growth. So coming to the soft palate, it is a mucus covered fibromuscular glandular curtain. Okay, fibromuscular-glandular curtain. Okay, which hangs from the posterior margin of the hard palate and extends backward and downward between the nasal and oral parts of the pharynx. Okay, so its anterior third is fibrous, middle third is muscular, and the posterior third is glandular, fibromusculo-glandular. Okay, the movements of the soft palate help in deglutition, speech, and blowing air through the mouth by closing the pharyngeal isthmus, which communicates the naso and oropharynx. Coming to the presenting parts, it has two surfaces and four borders. So it has an anterior surface and a posterior surface. Okay, coming to the anterior surface, it is concave and it presents a median raphe. The surface becomes inferior when the palate is stretched. Coming to the posterior surface, it is convex, directed backward and upward, and it forms the anterior boundary of the pharyngeal isthmus. Okay, this is the pharyngeal isthmus. This is the anterior boundary, the posterior surface. Okay, and it is connected on each side with the tubal elevation by the salpingo-palatine fold. Okay, salpingo-palatine fold. Coming to the, it has four borders, right? Upper, two lateral and lower borders. Upper border is attached to the posterior margin of the hard palate. Okay, upper border is attached like this. And then you have the lower border, which is free and presents in the middle, a conical elevation, which is called the uvula. Okay. From the base of the uvula, two mucous folds extend downwards on each side. We have the palatoglossal arch, okay, which contains the palatoglossus muscle, and palatopharyngeal arch, which contains the palatopharyngeus muscle, and we have two lateral borders which are continuous with the wall of the pharynx. Coming to the composition of the soft palate, it consists of a bilaminar fold of mucous membrane which contains the following structures. First, the palatine aponeurosis, 5 pairs of palatine muscles, nerves and vessels, and palatine glands. So coming to the mucous membrane, it is non-keratinized stratified squamous epithelium, okay, except the upper part of posterior surface, which is close to the floor of nasal cavity. Because it is related to nasal cavity, epithelium is ciliated columnar. Okay, now change of the mucous membrane epithelium, it takes place at the passavant's ridge, okay, when the pharynx comes in contact. Coming to the palatine aponeurosis, it is nothing but the expanded tendon of the tensor valli palatini, okay. Tensor, the tension is more because it is tensed, it creates a tensed structure called an aponeurosis, okay. It is a fibrous framework of the soft palate where all the palatal muscles are attached. It is the expanded tendon of insertion of tensor valli palatini muscle. The aponeurosis is attached in front to the posterior margin of the palatine crest. Okay, it is attached to the palatine crest. On each side, it is continuous with the tendon of tensor valli palatini. In the midline, it splits to enclose the musculus uvulae. Okay, it splits to enclose the musculus uvulae. Okay, now coming to the palatine muscles, they are arranged in 5 pairs. First, coming to levator valli palatini. So each muscle arises from the undersurface of the petrous temporal. Okay, here you have the petrous part of temporal bone. So it arises from the undersurface of petrous temporal bone in front of the opening of the carotid canal. And then it also takes origin from carotid sheath and also medial lamina of the auditory tube, cartilaginous part of auditory tube. Okay, each muscle, once again, so petrous temporal bone, medial part of auditory tube and carotid canal. So it passes downward through the sinus of Morgagni, okay, above the superior constrictor muscle of the pharynx, and it is inserted into the upper surface of the palatine aponeurosis between the both muscle fasciculae, anterior and posterior fasciculae of palatopharyngeus. Here you can see anterior and posterior fasciculae of palatopharyngeus. So that is in between these two muscle laminae, this muscle levator valley palatine, it attaches. Okay, the action. Okay, levator valley palatine, it forms an upward sling like this. Okay, on each side. So U-shaped sling. Action: these muscles elevate the soft palate and close the pharyngeal isthmus. Coming to tensor valley palatine. Okay, from the medial aspect of auditory tube, the levator valley palatine was taking origin. So from the lateral aspect, the tensor valley palatine takes origin. Okay, so tensor valley palatine takes origin from that, as well as from the scaphoid fossa of the medial pterygoid plate. Okay, and also from the lateral part of auditory tube and the sulcus tubae and spine of the sphenoid bone. See, tensor, T for tensor, T for tubae. Okay, tensor valley palatine, it dilates the tubae. It is called dilator tubae. Okay, that is why. So it takes origin from sulcus tubae as well and the spine of the sphenoid bone. Okay, spine of sphenoid, lateral part of auditory tube, and also from the scaphoid fossa. So the muscle is triangular in shape. It turns medially around the lateral side of the pterygoid hamulus, from which it is separated by a bursa, and it reaches a soft palate for insertion as the palatine aponeurosis itself. Okay, so it passes through the tendinous arch of the origin of the buccinator muscle, tensor valley palatine. Coming to the action, it tenses the soft palate. At the same time, it dilates the tube, auditory tube, so it is called dilator tubae. Coming to the musculus uvulae, each muscle arises from posterior nasal spine of the hard palate. So here you can see it arises from posterior nasal spine of the hard palate. Okay, and then it inserts into the submucous tissue at the base of the uvula. It inserts into submucosa. It pulls the uvula forward to its own side. Okay. Coming to the palatopharyngeus, it takes origin in two lamina, okay, or two fasciculi. It takes origin from upper surface of the palatine aponeurosis, as you can see here, upper surface of the palatine aponeurosis. Okay, so by anterior and posterior fasciculi. Anterior fasciculus arises from upper part of palatine aponeurosis. Posterior arises from lower part of the palatine aponeurosis. Both the fasciculi, they join posterolaterally to form a single muscle, which passes under the cover of the palatopharyngeal arch. Okay, it joins with the salpingopharyngeus and stylopharyngeus muscles in the pharynx, and it is inserted as follows. Okay, it is inserted onto the thyroid cartilage. Okay, and some of them they insert onto the pharyngeal raphe, and some of them they sweep backward under the cover of the passavant ridge and form a U-shaped sling of palatopharyngeal sphincter. Okay, they are going onto the thyroid cartilage, they are going onto the pharyngeal ridge, and they are forming a U-shaped sling around the passavant ridge. Okay, so it closes the pharyngeal isthmus. Okay, like this, and it also elevates the larynx and the pharynx. Coming to palatoglossus muscle, each muscle arises from the undersurface of the palatine aponeurosis, as you can see here, and it passes downwards under the cover of the palatoglossal arch, and it is inserted into the side of the tongue at the junction of anterior 2/3 and posterior 1/3. Few fibers are continuous with the transversus linguae muscle. It elevates the base of the tongue and it closes the oropharyngeal isthmus. Okay, the soft palate is a meeting place of three U-shaped sling of muscles. Okay, as you can see, the sling of levator valley palatine elevates the palate, that of passavant ridge from the palatopharyngeus approximates the pharyngeal isthmus, and the sling of the palatoglossus narrows the oropharyngeal isthmus. Okay, coming to the nerves and vessels. Coming to motor nerves, all muscles of the soft palate are supplied by the cranial part of accessory nerve, except through the cranial part of accessory nerve through the pharyngeal plexus, AP, P for palate, P for pharyngeal plexus. Okay, by the accessory nerve, except the tensor valley palatine. So tensor valley palatine, it has a lot of tension, and when a person is under tension, he doesn't think properly. Alright, so he doesn't go with the group, he thinks separately and gets a separate nerve supply from the otic ganglion. Okay, from the trunk of the mandibular nerve without relay from the otic ganglion. Okay. Coming to the secretomotor fibers, preganglionic fibers arise from the superior salivatory nucleus, pass through the facial, greater petrosal, Vidian nerve, and are relayed into the pterygopalatine ganglion. Postganglionic fibers reach the glands via lesser and greater palatine nerves. General sensory are from the greater and lesser palatine nerves, and also special sensory are from the glossopharyngeal nerves. Arterial supply, we have greater and lesser palatine branches of the maxillary artery, and we have an ascending palatine branch of the facial artery. Veins drain into the pharyngeal venous plexus, where the paratonsillar veins, lymphatic drainage into retropharyngeal and upper group of deep cervical lymph nodes. So coming to this arrangement of structures of the soft palate, from above downwards, see, first we have mucous. See, nasal cavity is above, oral cavity is below. So with the mucosa of the nasopharyngeal surface and a layer of glands. Okay, similarly below we have the mucous membrane of the buccal surface and a layer of glands. Mucosa, glands. Then we have the anterior fasciculus of the palatopharyngeus, between it levator palatine, then the posterior fasciculus of the palatopharyngeus, then palatine aponeurosis, which splits to enclose musculus uvulae, and finally we have palatoglossa. Coming to the applied anatomy, the paralysis of the palatal muscles after diphtheria is occasionally observed in children. The affected individual suffers from nasal voice. Okay, there is nasal intonation to the voice and regurgitation of food through the nose even when swallowing is attempted.